You are probably interested in a nursing position, but you don't know which one to choose from. If that's you, you've come to the right place.
So all I want is just to get paid. I know I ain't ashamed of trying to make a wage.
Hi everyone, if you're new here, my name is Vanessa, and in today's video we're going to talk about different nursing positions. The first position on the list is Certified Nursing Assistant, known as CNAs. CNAs are a type of nurses who help patients with a variety of activities like dressing. They help patients take their medication. They also monitor patients' vital signs and help them exercise. Next position on the list is Home Health Nurses. Home health nurses are nurses who care for patients in their home settings. This type of nurses can care for patients who are terminally ill, geriatric patients, or patients of old age, and they can also care for patients with mobility issues. Next on the list, we have registered nurse managers. Registered nurse managers are a type of nurses who supervise and manage members of the nursing staff. Their various duties include overseeing patient care, creating work schedules, and also scheduling meetings when they are important or necessary. Next on the list, we have registered nurses. Registered nurses are a type of nurses who create treatment plans for patients with a variety of illnesses or conditions, and they can work across several specialties. These nurses are usually known as RNs. Next on the list, we have charge nurses. Charge nurses have duties similar to RNs, but they also handle some administrative tasks such as scheduling and managing. Because of their duties, they may not see many patients face to face. Next on the list, we have pediatric nurses. Pediatric nurses provide care to children in various medical or healthcare settings. They often treat minor injuries and administer vaccinations to children. Next on the list, we have operating room nurses, usually known as OR nurses or scrub nurses. These kind of nurses work in hospitals and care for patients before, during, and after surgery. OR nurses provide streamlined communication between surgical team and the patient's family. Next on the list, we have dialysis nurses. Dialysis nurses care for patients experiencing kidney failure. They provide patients with advice on living healthy lifestyles and support those awaiting new kidneys. Next on the list, we have radiology nurses. Radiology nurses care for patients undergoing diagnostic imaging procedures and radiation therapy. They do so by preparing them for various scans, MRIs, and other tests administered by physicians and performed by radiological technologists. Next on the list, we have neonatal intensive care unit nurses, usually known as NICU nurses. NICU nurses care for premature or sick newborn children. Working in the neonatal intensive care unit, NICU nurses monitor newborns and their various conditions. This type of nurses also provide a source of contact for parents whose NICU babies are in their care. Next on the list, we have oncology nurses. Oncology nurses care for a variety of cancer patients at all stages. Along with administering medication, oncology nurses observe patients and their ongoing progress. Oncology nurses work to display a great deal of empathy to their patients and families as they undergo cancer diagnosis and treatment. Next on the list, we have travel nurses. Travel nurses are nurses that move from city to city to provide care for patients in understaffed hospitals or medical facilities. Travel nurses can be specialized or perform general duties. Next on the list, we have emergency room nurses. Emergency room nurses care for a variety of patients that enter the hospital's emergency room. While some deal with non-life-threatening injuries and illnesses, others handle traumatic and life-threatening conditions. Next on the list, we have labor and delivery nurses. Labor and delivery nurses help with the birth of a new baby. They support expectant mothers both during and after labor. These nurses specialize in the operations, aftercare, and support of labor and delivery practices. Next on the list, we have cardiovascular nurses. Cardiovascular nurses are also known as cardiac nurses. They treat patients with various heart diseases or conditions, or patients who have recently undergone heart surgery or procedures. Next on the list, we have nurse practitioners or NPs. Nurse practitioners work under the direction of doctors and have the ability to perform tasks beyond typical nursing care. Like physicians, NPs can diagnose conditions and prescribe treatments and medication. Next on the list, we have intensive care unit registered nurses, known as ICU nurses. These kind of nurses handle the care of patients with life-threatening injuries. Similar to the emergency room nurses, ICU nurses think quickly to help with emergencies as they arise. Not forgetting psychiatric nurses. Psychiatric mental health nurses diagnose and treat patients that suffer from mental illnesses. This type of nurses work to help patients manage their medications and understand their mental health condition. This brings us to the end of the video. If you enjoyed the video or you found it helpful, please don't forget to like, comment, share. See you in my next one. Bye bye.
So all I want is just to get paid. I know I ain't ashamed of trying to make a way.